Hello everyone. So today's topic is succinylcholine. It's very important topic and many times it has been asked in the examination. So today's video is all about the succinylcholine. This is Dr. Meenakshi Gupta from the Conceptual Pharmacology channel. If you like my video, please subscribe my channel and put up your important suggestion in the comment section. So let's get started with the succinylcholine. So what is the succinylcholine? It is a skeletal muscle relaxant. What is it? It is a skeletal muscle relaxant. So it is going to reduce the tone of the skeletal muscle, or it is going to cause the relaxation of the skeletal muscle. So let me give you a brief introduction about the succinylcholine. Here is the classification of the skeletal muscle relaxant. As you can see, we can classify it into two broadly: centrally acting and the peripheral acting. So these are all group of centrally acting skeletal muscle relaxant. If we see the peripheral acting, they are further categorized into two: neuromuscular blocking agent and directly acting, right? Then under the neuromuscular blocking agent, that is further categorized into three: non-depolarizing, depolarizing, and the agent which is going to directly inhibit the acetylcholine release. Then non-depolarizing, that is also called a competitive, it is further classified into long acting, intermediate acting and a short acting. So here is the this thing, succinylcholine. So we will be discussing everything about the succinylcholine. So where it comes, so if this question comes on the succinylcholine, what you are supposed to write? It is a number one, skeletal muscle relaxant. Now what kind of skeletal muscle relaxant it is? It is a peripheral acting skeletal muscle relaxant. Number one is this. So it is a peripheral acting. What is this? It is a peripheral acting skeletal muscle relaxant. Now it acts on the neuromuscular junction. That's why it is called a neuromuscular blocking agent. Then the third point is it is going to cause a depolarization of the neuromuscular junction. That's why it is called a depolarizing blocker. Now the another name for the succinylcholine is succinylcholine. So there are two depolarizing blocker. One is succinylcholine and one is a decamethonium. Succinylcholine, also called as succinylcholine, but more popularly it is called as a succinylcholine. So if you talk about the succinylcholine, so it very much it sounds like a acetylcholine. Just like acetylcholine, it depolarizes. Succinylcholine, that also depolarizes the neuromuscular junction. So a little bit about the chemistry part. This succinylcholine, it is a quaternary, number one, it is a quaternary ammonium compound. It's a quaternary ammonium compound. This is one. And if you look at its structure, here I am not showing you. So it looks like two acetylcholine molecule, they are bound together. So it's very much, it resembles with the acetylcholine. So two acetylcholine molecule, they are bind together. That is the structure of the succinylcholine. Now how it acts, what is the mechanism of action of succinylcholine? So for that you must know what is the normal physiology of the skeletal muscle, how normally the skeletal muscle it contracts. This is the structure of the neuromuscular junction. This illustration I have taken it from the basic and clinical pharmacology book by Katzung. So here you can see the neuromuscular junction. This is a nerve and this is the muscle. So what happens? There is the initiation of the impulse. That impulse, it is going to reach here at the motor end. So what will happen? There is a generation of the action potential. There is a generation of action potential. Once there is a generation of action potential here, then what will happen? These are the vesicles. V stands for the vesicle. And these vesicles, they contain what? They contain important neurotransmitter, that is ACH, that is acetylcholine. So once what happens, there is a generation of action potential. The action potential, once it is generated, there is a fusion of these vesicles with the end membrane, and ultimately there is a release of this acetylcholine in the synapse. Now this acetylcholine, On the muscle end plate, there are the receptor, acetylcholine receptor. Now, what kind of receptor they are? So, as you know, the acetylcholine, I'll write here, the acetylcholine, it acts with the two type of receptor. One is nicotinic and another one is muscarinic. Muscarinic is further of three type, M1, M2, M3. Let's not discuss in detail about that. Whereas a nicotinic receptor, they are of two type, N, N and N, M. N which is present in the ganglion and M which is present in the neuromuscular junction. So here acetylcholine, it acts through which type of receptor? It is going to act through this NM type of receptor, right? So this type of receptor, they are there at the neuromuscular junction. Now this NM type of receptor, what kind of this? It is a ion channel or ion linked receptor, ion channel linked receptor. Now which ion? It is a sodium ion. So once this acetylcholine, it is going to bind with the acetylcholine receptor, what will happen? There will be opening of this ion channel. Once this ion channel, it opens, then what will happen? There is an influx of the sodium ions. Now this sodium ion influx, so what will happen? Depolarization. Sodium, always remember, the positive ion, they are going to generate what? They are going to generate the depolarization. So there is a depolarization of this end plate. And this depolarization, it is going to spread throughout and it is going to cause the what? Muscle, generate the muscle action potential, which is called the MAP. Now with the generation of muscle action potential, what will happen? The muscle, it will be contract. So this is a contraction. So how the normal contraction happens, you can see the same thing here. There is initiation of the impulse, right? Then impulse that is going to reach at the motor nerve terminal. Then nerve action potential that is generated, which causes the release of acetylcholine that is going to bind with the nicotinic receptor. This, and once it binds with the nicotinic receptor, it is ion channel ring receptor. There will be opening of this sodium channel and influx of the sodium, and this leads to the development of end plate potential, leading to muscle action potential and contraction of the skeletal muscle happens. So what is important over here in this case? Here important thing is this acetylcholine, though it binds with the receptor, it is going to generate this muscle action potential and contraction happens. But this acetylcholine, it is degraded by this enzyme, acetylcholinesterase, very much present here. It is hydrolyzed by acetylcholinesterase. So now what will happen? It is hydrolyzed by acetylcholinesterase, then that leads to the repolarization. What happens? Repolarization. Now it is again ready for the next impulse. So always remember one thing, there should be binding and unbinding of this acetylcholine to the receptor. So this should depolarize, and for the next depolarization to happen, it must repolarize. This is very important thing. For any this in contraction thing, it must remember one thing, what I'm telling, it should depolarize and then repolarize, so that again the next impulse can come and cause a depolarization of this end plate, and that leads to muscle action potential. So this is the normal physiology of the skeletal muscle contraction. Now coming to the succinylcholine, how it works, right? Now succinylcholine, already I have told you, it is quaternary ammonium compound. It looks like two acetylcholine molecule, they are bound together. So the very much it is also going to bind with the same receptor, NM receptor, succinylcholine. So it has got, remember one thing, succinylcholine, it has got affinity for the NM receptor. That is tendency of the drug to bind with the receptor. Plus it has got an intrinsic activity, but that is submaximal. That is submaximal intrinsic activity for the NM type of receptor, right? Now succinylcholine, it will also come and it is going to bind with the same receptor where the acetylcholine binds. So it binds where? It binds with the nicotinic receptor. With what type of receptor? It is again NM type of receptor. Once it binds with the NM type of receptor, then what will happen? There is depolarization will happen, and that depolarization leads to opening of this receptor, and there is a influx of this sodium ion. Okay, now this influx of the sodium ion will lead to what? It is going to cause the muscle contraction. Now here important thing is, now this succinylcholine, it is not degraded by the acetylcholinesterase, just like the acetylcholine that is degraded. Now this is not degraded, this will be very much present over here. And another important point, the succinylcholine before coming and binding to the receptor, it is degraded by the pseudocholinesterase in the plasma. So after the hydrolysis, it reaches here and then it binds. But once it binds here, now it is not hydrolyzed by the acetylcholinesterase which is present over there. So it is not hydrolyzed by the succinylcholine, not hydrolyzed. So this is very important point. So it is not hydrolyzed. Now what will happen? It will occupy the same seat. Like acetylcholine, it binds and unbinds. अब ये क्या है? ये यहाँ पे आकर बैठ गई है. It will not allow anybody to sit on this place. And this succinylcholine, because it's continuously binding over there, now instead of depolarization, what it is going to cause? It will produce the persistent depolarization. You can say persistent partial depolarization or persistent depolarization. Few books write there, both are correct. It is going to cause a persistent depolarization. So what I told you just now, for the next depolarization, the membrane should repolarize. अब इसमें क्या है? Persistent depolarization that leads to twitchings and fasciculation of the muscle, but there is no repolarization. The membrane action potential does not return to the repolarization state. Rather, what will happen? The sodium channel, it will remain inactive. Submaximal है ना, it will remain inactive, and membrane potential will be minus 50 millivolt. Persistent depolarization will be there. Now with the next impulse, now if acetylcholine that is released with the next impulse, this acetylcholine, it will not bind because there is no repolarization. It is not responsive to this acetylcholine. It won't be able to bind, and again there will be, what will happen now? It is not able to bind. There will be no depolarization, no generation of end plate potential, no generation of muscle action potential, and no contraction. So ultimately that leads to flaccid paralysis. So succinylcholine, its mechanism of action, remember one thing, it has got the two phases, phase 1 and phase 2. Just now I talked about the phase 1, right? Now this phase 1, you can see in the next figure also what happens in a phase 1, right? Succinylcholine, it reaches the neuromuscular junction after being hydrolyzed by the pseudocholinesterase. Then it binds to the NM receptor. Once it binds to the NM receptor, then there will be opening of the sodium channel and influx of the sodium ion. Once that opens and influx, it is going to cause a depolarization, and now it is going to cause a depolarization. It is not hydrolyzed. It will sit over there. That leads to persistent depolarization, and there will be twitching and muscle contraction. Now it is, do not dissociate succinylcholine. It do not dissociate rapidly and are not hydrolyzed by acetylcholinesterase. So they produce prolonged depolarization around the muscle end plate, and that leads to inactivation of the sodium channel. Now there is a no repolarization. Now no repolarization, right here, one point is missing. There is no repolarization of the membrane. Now no repolarization of the membrane. So membrane is not responsive. It is unresponsive to this acetylcholine release. So it is not able to generate the muscle action potential. So ultimately it leads to the flaccid paralysis. Right? So this phase 1 is followed by phase 2 block. Now what happens in the phase 2 block? Now succinylcholine, it is as such, it is there, it bounds with the receptor. Now membrane, it is repolarized. You look at here, membrane, it is repolarized. Then if it is repolarized, that means now acetylcholine, once it comes, it should be able to bind with the receptor and should be able to generate the end plate potential, and followed by muscle action potential, followed by the contraction. But sorry, this does not happen. What happens? Because of the continuous exposure of this succinylcholine to the receptor, what happens to receptor? They get desensitized. What happens to the receptor? They get desensitized. Now acetylcholine won't able to bind with the receptor, because now receptor, it is desensitized, and this leads to what? There is no generation of this muscle action potential, no contraction. So ultimately this also leads to the flaccid paralysis, and this paralysis, it is very much similar to the paralysis which we get with the competitive blocker, or you can say the non-depolarizing blocker. The same way, non-depolarizing blocker. Right? And slowly what happened? This succinylcholine, it is metabolized, it is removed by the cholinesterases, and again the membrane restore the sensitization, and it is again ready to receive the impulse and ready for the activation. So succinylcholine, it is a fast acting neuromuscular blocking agent with short duration of action. So this succinylcholine, it is very commonly asked, especially its mechanism of action, phase 1 and phase 2. Sometimes they ask the dual block of succinylcholine. So dual block is, that means they are asking about the phase 1 and phase 2. Let me summarize again, revise all that so far what we have studied about the succinylcholine. So if the question comes on the succinylcholine, what you are supposed to write? Succinylcholine, it is a peripheral, number 1 is this, it is a peripheral acting skeletal muscle relaxant. It acts by blocking the neuromuscular junction, so also called the neuromuscular blocking agent, because it depolarizes this, it depolarizes the neuromuscular junction. That's why it is called depolarizing blocker. Another name for this is succinylcholine. There are two depolarizing blocker, one is succinylcholine, other one is decamethonium, and it is a quaternary ammonium compound. It looks like the two acetylcholine molecule, they are bound together. Then you are going to write its mechanism of action. So initially you explain the normal contraction of the physiology of the skeletal muscle. Okay, how normally this skeletal muscle contraction happens. You can draw the diagram also, or you can write this flow chart also. So what happens initially? There is initiation of the impulse, then that impulse will arrive here. Then what will happen? Generation of the action potential. To the generation of action potential, this vesicles, it fuse with the, I will see, so in the release of acetylcholine bind with the NM receptor, opening of the sodium channel, influx of the sodium, generation of the end plate potential, then muscle action potential, then that leads to the contraction. Now acetylcholine, it bounds but it unbound also. ये पॉइंट इसमें बड़ा इंपॉर्टेंट है. एसिटाइलकोलिन और सक्सिनाइलकोलिन में एसिटाइलकोलिन जब भी लगेगी उसके साथ इट अनबाउंड्स it, because it is hydrolyzed by the cholinesterase, acetylcholinesterase. Here is cholinesterase, spelling is cholinesterase. So that leads to the repolarization. Now it is again ready for the next impulse. Now succinylcholine, it has got the affinity but sub-maximal intrinsic activity So there are two phases of succinylcholine. Phase 1. In phase 1, what happens? It binds with the receptor just like acetylcholine it binds. So with the binding, what will happen? There is a depolarization, and that depolarization, action potential will be generated. Depolarization, so there will be influx of the sodium that leads to the depolarization. Now this succinylcholine here, it does not unbind. ये इसके साथ आकर लगी रहेगी. It will not bind because it is not hydrolyzed by the acetylcholinesterase. Now it will bind over here, it will remain over here. Now if the acetylcholine it comes, it will not bind over here because succinylcholine that is already sitting, वो हटेगी तो ये लगेगी ना उसके साथ. So acetylcholine it will not be able to bind, and succinylcholine, because it is not removed by the acetylcholinesterases, it will bind here, though there is no repolarization. Now no repolarization, if there is no repolarization, then remember the membrane is not responsive. If the membrane is not responsive, acetylcholine will not be able to bind. No generation of end plate potential, no generation of muscle action potential, no contraction. That leads to the flaccid paralysis. So this phase 1, it is followed by the phase 2. Now what happens in the phase 2? Now though the membrane it is repolarized, but with the continuous exposure of the succinylcholine on this receptor get desensitized. Desensitization of the receptor that happens. Now again acetylcholine it won't be able to bind. That leads to the flaccid paralysis. So this is about the dual block. Hope you understand. That's all about today's video.